Okay, so in this section now, we're going to talk about ergonomics and how they relate to manual handling. And really, what we're talking about here is trying to adapt ourselves and the environment and the equipment to allow the task to be completed as safely and efficiently as possible. So, just an example of that here is this is a picture taken on the farm in Ballyhaise, and you can see the barrier dividing this cattle pen from the passageway contains a head gate. So if we need to restrain one of these animals to examine it or to treat it, we can put some feed out here on the ground. The animal puts its head out to eat as normal, and then we can slide across the head gate here to close behind the animal's head over the neck and comfortably restrain them safely without us having to take them out of the pen or separate them from their companions and so on. So that's just an example of ergonomic design and how it can make manual handling safer and easier for all concerned. So really, when we're talking about ergonomics, we're thinking about the job itself, the task. Can we modify it in some way to make it safer? The environment in which the task is going to take place. Is it well lit? Can we see where we're going? Are there things on the floor we might trip or fall over? Is the environment wet? Is it humid or muggy or dusty? You know, what can we modify the environment to make it more suitable for the job? Then if we're moving something, think about, the load itself, what we're trying to move. Is it awkwardly shaped? Is it very heavy? Should I get someone to help me? And then individual capability. Am I able to do this task with the equipment available to me, or should I go and get help or get extra equipment? And I suppose the key thing to recognize here is that individual capability varies over time. So for example, you might normally be fit and strong and well capable of carrying a sedated 20-kilogram dog on your own. But if there's a day where you twisted your ankle that morning and it's sore and painful, obviously on that day your individual capability is reduced and you're not going to be able to carry a load that you normally would. Or if you're very tired, or let's say you've been injured or you're pregnant or you've got suffering from a bout of back pain. So it's important to recognize that capability is not fixed. It varies from person to person, and it varies for the same person over time. So just keep that in mind. Really what it boils down to here is kind of a bit of common sense, which people say common sense is not so common, unfortunately. But before you start a job, just stop and think about it. What am I doing? Is this the safe and sensible way to proceed, or are there things I should change before I get started? So thinking about the task then, ask yourself, do I have what I need to complete this task? Have I got all the equipment necessary? How am I going to carry it out? So for example, if I'm going to take a blood sample from an animal, have I got someone available to hold the animal for me? Do they know how to hold the animal safely and without hurting it? Do I have all the equipment I need? Have I got a sterile needle of the right length and gauge? Have I got in-date sampling bottles and so on? So think about, before you get started, have you got what you need? And then how am I going to actually do it? Is there a safer or more efficient way to carry it out? So for example, if the animal we want a blood sample is very painful and is going to resent handling because it's going to cause it extra discomfort, well then I'm going to stop. I'm going to go and ask the vet to prescribe some pain relief and administer that and give it time to work before we proceed to take the blood sample. So try and avoid getting stuck in kind of this is how we've always done it, or a blinkered mentality. It's a good idea to periodically stop and check what you're doing and just check, is there a better way to do this? Is this the most efficient way to proceed? Just some examples. Here's a photograph from Google of, presume these people are moving house, and you can see they've got a very large load. And this is certainly a unique way to move all these items. Is it the safest way? Possibly not. I really like how this guy here is leaning into the load with his left shoulder to keep it upright. I'm admiring his bike handling skills. But yeah, maybe it's not the most practical way to move a lot of equipment. Think about the environment as well. So where you're going to do the task, is it well lit? Have you enough room? Could you move the items to be transported closer together to reduce the amount of travel you have to do? Is there anything you might slip or fall over? Is there steps? Are there people around? If, for example, you're going to carry a cat through a ward or a kennel area that contains lots of barking dogs, you anticipate that being stressful for the animal at best, and at worst they might try and escape or scratch you if you're carrying them. What's the weather like if you're working outdoors? There's, just stop and consider the environment you're working in before you get started. If you look at this example, this photograph here is taken in one of the calf sheds in Ballyhaise, and these are Aberdeen Angus cross and Jersey cross calves, so they're dark brown or black in colour, and they're in a dark shed. You can see the camera flash because you can see the light reflecting in the tapetum in the back of their eyes. So if I want to examine these calves in this shed, I'm probably going to want to turn more lights on and maybe bring the calf to a better lit area to make it easier to examine, to ensure I don't miss important bits of information. The load then, what am I going to move? How heavy is it? What size and shape is it? Is it top heavy? Is it stable? If it's a living animal, is it going to wriggle or try to escape? Do I need some help? So you can see, for example, here in this picture, this is a load of hay. It's large and bulky, but it's very light. So it's quite straightforward to carry something that heavy on your back. Whereas, if you try to repeat this with a smaller but heavier load, it probably wouldn't be an efficient way to do it. So you've got to stop and think about the load and evaluate it before you start trying to move it. When it comes to animals, bear in mind as well that you've got to think about not only yourself and your ability to move it, but the animal's feeling about it. So in this case, this rather large cat doesn't appear to mind being carried, but if the animal is painful, it may object, or if it has an injury, we may need to move it on a stretcher to avoid making the injury worse. So you've got to think about all the participants in the job. We've mentioned then as well with individual capability that this is different. People are different heights and strengths and fitnesses, and also they might need skill or training to perform a task. They might be very experienced and able to do it on their own and make it look easy, whereas when you try it, you find it's not so straightforward. That's not uncommon. We mentioned as well that a person's capability varies over time. So for example, someone who's pregnant is going to be probably slightly less mobile than normal in the later stages of pregnancy. Or if you're injured, your capability might be reduced while the injury heals, or you have to be sensible. So it's important to recognize that the capabilities are varied and fluctuate over time. An important thing to emphasize here is that the legislation does not set weight limits for men or women. This idea comes up a lot. There is old legislation from other countries that stated this, but I want to reiterate this is not the case in Ireland. There is no weight limit or range or recommendation for individual genders. It's important to recognize that, the capability is individual and varies. So there isn't a magic number that someone can or cannot safely lift. So keep that in mind. Don't be telling me this in assignments, because it's just not the case. And if you think of it, it doesn't make sense. I know myself, I'm able to lift a 25 kilogram newborn foal if I have to. I prefer to have help, but I can manage it. Whereas the legislation people generally quote is 15 kilos. If I'm trying to deliver a foal, I'm not going to stop and tell the client, well, I'm sorry, your foal weighs more than 15 kilos, so I'm not going to try and deliver it. We're just going to have to wait for someone else to turn up. So just think about the practicalities of it. It's important as well to be able to assess your own capability. If you decide something is awkward or heavy, often it's better to make 2 trips instead of 1, or get some help. Don't get sucked into trying to rush and cut corners and lift something that's a bit too heavy for you, or a load that's a bit too awkward for you. It's just asking for trouble. So try and avoid the lazy man's load, okay? It's much better to make 2 trips with half the load than it is to try and stress yourself carrying something that's too heavy for you. But as I say, there is no set limit. It's up to you to assess each individual circumstance. Mechanization or equipment can be helpful. It can reduce the amount of manual handling required. So for example, rather than physically carrying boxes of fluids or bags of feed around the practice, we might use a trolley or something similar. A wheelbarrow, for example, can reduce the amount of effort required to move something. So where possible, we should use equipment if it's available to reduce the amount of manual handling required. And if we look at veterinary practice, we'll see lots of different examples. So we might use trolleys or hand trucks or stretchers to move goods or animals. We might find ourselves, trying to get extra people to help us. There might be specialized equipment that we can buy. So there's various ways in which we can reduce the amount of pulling and dragging that's required for many jobs. Some more examples here. Using a cattle crush to restrain large animals, adult cattle. Years ago, before people had cattle crushes, you're trying to catch them in the corner of the shed and you'd have 8 neighbours swinging out of them and they'd still be dragging you around the place. Whereas put them into a crush, it's much safer for everyone concerned. The animals are restrained in a group and you don't have to worry about trying to hang on to them to the same extent. Likewise, say with certain tasks, turning sheep over to trim their feet, it's backbreaking work if you have to do a group of them. Also, sometimes they can be uncomfortable for the sheep, or there's these special tilt tables that you walk the sheep into, and then there's a mechanized table that swings up and turns the animal over. It's much less work for the person involved, and also it means that the sheep's full body weight is supported by the shelf here, rather than having them lying against your legs and potentially restricting their airway or their lungs, particularly if they're heavily pregnant, for example. A few other examples, you know, if you take, say, anesthetized horses, this horse, you know, can weigh 600 kilos, 700 kilos. So to move it from the induction room into the operating theatre, or from the operating theatre back into the recovery room, is going to require mechanization. So in this case, there's an electric hoist here that lifts the animal by its legs after it's been anesthetized and it's unconscious. So you can see that the person here on the left has the controls of the hoist in their hand, and that once the animal is in position, they can raise and lower it on and off the table. They can also move the hoist, say, from this area back in here through the doors into the recovery room. So equipment like this is very valuable in reducing the amount of effort involved, but then it means that you have to maintain the equipment as well and look after it. There's no point having your hoist break down because you didn't service it, for example. I suppose the other thing to emphasize is that regardless of how much equipment we have, there's always going to be some lifting and in the job. So I'm going to ask you now to evaluate a few examples and think about how you might do it. So at this point, we're going to recap section 4. Before you start a task, just stop and have a think. Am I doing this as safely and efficiently as possible? Should I go and get extra help or equipment or change where I am? Should I try and move the animal closer to the area where I want it? Can I avoid having deliveries dropped off here at the far end of the hospital from where the equipment is stored, and so on? Think about then individuals. There's no set number for how much a person can or can't or should or shouldn't lift. It varies from person to person, and it varies within people over time. So it's important to recognize that each time you go to do a task, you should stop and assess it and think about safe and efficient ways to do so. And then mechanization can be very helpful. If we have equipment, we should use it, we should look after it, make sure it's well maintained and kept in good working order, but recognize that it won't completely replace the need for manual handling, especially in a veterinary practice environment. Okay, that's it on ergonomics. I'm going to stop here now, and in our next section, we're going to move on and look at lifting techniques and how to apply them in the veterinary practice workplace.